Hi, everyone. Welcome to our monthly SOPHIA webinar. I'm Sandra Whitehead. I am the current president of SOPHIA, and it's my pleasure to welcome you today. We're so glad that you've found us. If you're not familiar with SOPHIA, we are a membership organization that supports and creates resources to support the work of health impact assessment and health in all policies. And today we have a very special guest, my friend and colleague, Dr. Ben Pauli from Kettering University. Ben has worked with me on the National Environmental Justice Advisory Council for several years, maybe 5 years. Ben, could that be right? Ish, yeah. And we've worked on reports around the PFAS report for EPA, and we're currently working on a cumulative impact assessment work group that I coach here. And part of that work is looking at recommendations that we would make to the EPA on how to include community voice. And Ben is going to share his research with us around this today and give us some things to think about. So I'm going to turn it over to you, Ben.
Right. Well, thanks so much for that introduction, Sandra. And thanks also for extending the invitation to present to the group. It's my honor and pleasure to be here. And thanks to everybody on the call for participating. It's good to be with you. And although I will be doing some presenting, what I'm really looking forward to is the conversation afterwards, because I'm sure I have a lot to learn from everybody here about the topic at hand. So I envision this presentation more as kind of a framing presentation. And then if we want to get further into any weeds, we can maybe do that during the discussion, depending on what people want to talk about. So what I'd like to discuss today, and let me see if I can successfully share my screen. Hopefully everybody's seeing that.
Yeah, looks good.
Okay, great. What I'd like to talk today about is how it is that we conceptualize and make use of lived experience and community narrative in impact assessment and decision-making related to matters of health and the environment. And I thought it would be worth saying something about how I've come to be working on this topic. I am not myself an impact assessment practitioner, at least not in any formal way. And I'm also not an environmental decision maker in any official capacity. But my experience over the past 8 years of living and working in Flint, Michigan during the Flint water crisis has certainly inspired me to think a lot about all the various ways in which a community can be impacted from both a health and an environmental perspective. And it's also taught me the importance of listening carefully to what impacted people themselves have to say about what's going on. So when I moved to Flint in the summer of 2015, there were lots of people around who had been impacted by the water in one way or another. But somehow there was still no officially recognized Flint water crisis. The official narrative was that subsequent to switching the city's drinking water supply to the Flint River in April 2014, there had been some hiccups here and there, but those had been addressed, and the system was stable, and the water was safe to drink. That's what my family was told, and we are believers in public tap water, and so we were among those residents who trusted that message. But of course, not everybody bought into it. Certainly not those who had personally experienced water quality issues or health problems they believed were linked to the water. For over a year, these residents had been talking to each other about what they were experiencing with the water. They had been collecting evidence of impact, posting pictures on social media and so forth. They had at various times and in various ways presented this evidence to local, state, and federal officials. And now I find out whether I can actually advance my slides. There we go. To local, state, and federal officials, to the media, to anyone who would listen, and it just wasn't inspiring the kind of action they thought was needed. This kind of a dynamic is very familiar to those of us who study environmental injustice. And in Flint, as in other communities where people have raised similar concerns to no avail, residents experienced it as a kind of epistemic injustice. They didn't use the term, of course, but they certainly felt wronged, as the philosopher Miranda Fricker puts it here, in their capacity as knowers. They believed that they were presenting sound and compelling evidence of a serious problem, but they were treated like they didn't know what they were talking about. And the leading theories I encountered within the community as to why this was pointed to what Fricker calls testimonial injustice, when someone's testimony is not believed because those they're trying to communicate with harbor some sort of a prejudice about them. Residents told me that they weren't being taken seriously because they were Black, because they were women, because they didn't have fancy degrees. Lots of things can contribute to testimonial injustice. And this became a strategic consideration within water activist circles. People came to appreciate the strategic value of having spokespeople and allies who were white, male, and or had some letters after their names. But activists also realized that part of what made them vulnerable to being dismissed was the kind of evidence they were bringing forward. And that wasn't necessarily immediately obvious. When your water comes out of the tap dark brown, you probably start out thinking, well, all I need to do is show this to people and they'll see that there's an obvious problem. Then you bring your discolored water bottle to the town hall meeting and you find that it's not having the effect that you thought it would. It turns out that there are perfectly good explanations for occasional discoloration, and that it's an aesthetic problem and not a health risk, and so on. So if there's something truly threatening about the water, it's going to have to be demonstrated in some other way. Okay, well, now I have a high lead test. Yes, but that's just one house where there are some anomalies with the service line. So now there are problems with the quantity and the representativeness of data that we have to confront. So, despite being themselves convinced that Flint needed to get off of the river, given the available evidence, activists concluded that in order to move the needle with officials, they were going to need a different kind of evidence. Scientific, quote unquote, proof of unambiguous health threats and a large number of samples collected from across the city. Long story short, they were able to produce exactly that kind of evidence in the summer of 2015 through a collaboration with an engineering team. And this proved to be a major step in triggering an official response. Now, the engineers involved in that work liked to talk about it as being a validation of science, an illustration of the power of science to uncover obfuscated truths and defend public health. They also held it up as a model of so-called citizen science, demonstrating the power of collaboration between lay people and technical experts. But there was another way of looking at this outcome from the perspective of Flint residents. What had been validated above all were their earliest intuitions that something was in fact wrong. It was confirmation that the early evidence brought forward of poor water quality should have been interpreted by officials the way residents were interpreting it, as a smoking gun justifying drastic precautionary measures. The systematic study in the summer of 2015 could be seen from this perspective as a regrettable necessity, symbolizing the inadequacy of the community's epistemology and the impotency of residents in their efforts to spur action on the basis of what they had concluded was true and right. The lesson to be learned, perhaps, was not that we could all use a little more science in our lives, but that we should listen to people in the first place when they speak about their lived experience. So part of what was interesting to me about the broader coverage of and response to the Flint water crisis was how it picked up on both of these threads, the science part and the lived experience part. On one hand, the engineers involved were lionized as scientific heroes, given all kinds of awards. And leaders of the citizen science community proclaimed the collaboration in Flint to be a new gold standard. Some of them have walked that back a bit in more recent years. But anyway, at least early on, that was supposed to be one of the big themes here: science to the rescue, science for democracy and justice, and so on. But once the water crisis became one of the big stories of the day, the pendulum also swung pretty dramatically to the other side of the spectrum in terms of people's willingness to listen to and respect Flint residents' voices. Residents were repeatedly given a platform all the way up to the national and sometimes international levels to speak about the impact of the crisis from their perspective, often with little or no expectation of supporting scientific evidence for any specific claim. All of a sudden, residents were being given the benefit of the doubt, not always or in every context, but much more so than before. So I do think that the importance of hearing and respecting accounts of lived experience was another takeaway lesson that resonated pretty widely. And in the years since the crisis first came to light, members of many other environmental justice communities have had the opportunity to speak to larger and more receptive audiences. And I think that that is a big part of the broader environmental justice moment that we're living in. But the development that matters even more for our purposes today, I think, is that we are starting to see lived experience feature much more prominently in the discourse of officials and agencies charged with public health and environmental protection. We are getting some indications at the highest levels that what residents of impacted communities have to say about their own struggles and their own needs might actually stand a chance of influencing decision-making with respect to things like the allocation of resources, the granting of permits, and so on. As you may know, one of the first things President Biden did upon taking office was to issue an executive order that strengthened the federal commitment to environmental justice. And in the words of CEQ Chair Brenda Mallory, this order, quote, specifically calls for a focus on environmental justice in ways that bring communities and community voices and lived experiences into the White House, so that we are making sure that's part of what we are considering when we look at policies. Biden signed another similar executive order earlier this year, prompted by the White House Environmental Justice Advisory Council. Jade Begay, a member of that council, commented that, quote, this action from the Biden administration signals that our guidance and feedback informed by our lived experience as environmental justice and tribal community members is not only being heard, but is being implemented in the ways that we need. So that's something. But before we conclude that lived experience is in the middle of a triumphant long march through our institutions, I want to offer an anecdote that might give us some reason for pause. For the past year or so, in addition to my work with NEJAC, the National Environmental Justice Advisory Council, I've been serving on a work group under the National Drinking Water Advisory Council to the EPA. And we've been asked to recommend revisions to rules that are aimed at stopping the spread of deadly waterborne bacteria. And part of our charge is to look for, quote, opportunities to advance environmental justice in regulatory revisions to equitably protect consumers' health, particularly disadvantaged and historically underserved consumers. So how do we advance environmental justice when it comes to deadly waterborne disease? Well, of course, first we would want to know something about any disproportionate impact that marginalized communities are facing with respect to such disease. And when we run the numbers, the most striking example of that in the United States, anyway, is the case of Legionnaire's disease, which is caused by Legionella bacteria. Legionnaire's disease is, in fact, the deadliest waterborne disease in this country, but it's deadlier for some more than it is for others. As the CDC data illustrates, African Americans are more than twice as likely to contract Legionnaire's disease as whites. Legionella, I should say, is also an opportunistic pathogen, so-called. So it preys upon people who have underlying health conditions of various kinds. And we were disproportionately impacted by Legionnaires right here in Flint. In the summers of 2014 and 2015, when we were on the Flint River, we experienced one of the most severe outbreaks of Legionnaires in American history, leading to at least 12 deaths. So it's pretty easy to show in this kind of bird's eye quantitative manner that there's some amount of disproportionate impact here. But is that all we might want to know about impact from an environmental justice perspective? Well, what allows us to really gauge the severity and significance of impact is looking at impact cumulatively. To make sense of these numbers, we need to know how Legionnaires is affecting people in their everyday lives, how it's intersecting with other health issues they're experiencing or other underlying vulnerabilities that they have. So we could do some more quantifying to get us further down that road. We could look at data on the general health of the population and so forth. But I would submit that there's going to be a lot that falls through our net unless we're hearing from the people who've actually been impacted by the disease. So when I was asked by the work group facilitator to talk to the group about the Legionnaire's issue from an environmental justice perspective, I thought the best way of doing that would be to have somebody come on from Flint who'd actually had Legionnaire's disease and let them do the talking. Long story short, we went back and forth about that, and I kept being told that there were too many people in the group who wouldn't see the relevance of listening to an anecdotal account from a Flint resident. Finally, I said, well, just let me show a 2-minute video clip of a young woman from our community named Jasmine McBride. She contracted Legionnaire's in 2014. It compounded health problems she was already experiencing, and ultimately she passed away at the age of 30. To listen to her tell her story and to see her struggle, on screen at least, is to understand in a deeper and more nuanced way the reality behind the numbers. But again, I was told, no, we probably shouldn't do that. We can't even show a 2-minute video. So in this work group, we will end up spending about a year talking about these issues without taking so much as 2 minutes to hear from someone who is actually living with the problem we're trying to solve. What this anecdote suggests to me is that still, even with EJ on everybody's lips, including EPA's, there are important sectors of the health and environmental protection establishment wherein decision makers think they can assess problems, protect public health, and even advance justice without hearing from impacted people. All we need are the numbers. Thanks very much. So this is why those of us who have learned, sometimes the hard way, how much we need lived experience, that lived experience has value. We need to be really clear right now, I think, about why and how it should enter into assessment and decision-making. And that means establishing unequivocally the importance of listening to community voices, not just as a matter of principle, because I think a lot of people are pretty sold on the principle part of that, not just as a matter of checking a box, but because you can't come to reliable conclusions and make good decisions without doing so. After all, you know, as I'm sure I don't need to tell you, gathering testimony and other kinds of qualitative data is hard. It's time-consuming, it's resource-intensive, it involves a lot of tricky considerations around avoiding disrespect and exploitation and so on. Our public health and environmental agencies are strapped as it is. Sometimes they may not feel like they're well-positioned to enforce even the barest bones of the law, much less go above and beyond. in factoring every last variable into their considerations. There's a lot of legal wariness, I think, when it comes to offering new and maybe subjective sounding rationales for telling people that they can't do things, like build a new polluting facility in an already overburdened community. Often that, making and defending decisions technocratically from an agency standpoint with, numbers, and more numbers, that may not be the most democratic way to operate, but it may be what stands up in court and, is otherwise defensible to the people that you're interacting with on a day-to-day basis. So, for all of these reasons, and probably more, the argument for lived experience in a regulatory context faces something of an uphill battle. But as innovative methods of cumulative impact assessment have begun to creep into regulatory contexts, or at least knock on the door, a potential opening has been created, I think, because within the wider world of impact assessment, lived experience does have at least something of a foothold. As you may know, in its current efforts to develop and implement a cumulative impacts framework, EPA is taking inspiration from health impact assessment. And from what I can tell, HIA practitioners have been pretty vocal about the importance of lived experience and its corollary, local knowledge. And I just wanted to offer a few examples of that. I've had fun over the past couple of weeks perusing all of the various materials that are up on the SOPHIA website. And I'm sure many of the people on this call are more familiar with these materials than I am. So I apologize for probably telling you some things you already know, but I at least wanted to highlight and pick out for our purposes today those examples of where lived experience or something like it gets mentioned, and I think taken seriously within those materials. So here's an example from the minimum elements and practice standards for health impact assessment. You can see here that under the general practice standards, it is asserted that HIA integrates knowledge from many disciplines, as well as from populations affected by the proposal, including local knowledge and lived experience. So that would, suggest that lived experience contains knowledge, or is linked at the very least to local knowledge that can be used in a meaningful way to come to conclusions about what the impact is in any given case. So that's granting it, a pretty significant epistemological status from that standpoint. If we go further down within this document, we find that under assessment specifically, it comes up again. Evidence used in assessment should come from multiple sources, and it ought to incorporate local knowledge. I was also interested in what it says a little bit further down about how the lack of formal scientific, quantitative, or published evidence should not preclude reasoned evaluation of potential health impacts. Other data sources, including professional expertise, lived experience, and local knowledge, should be included as evidence. So again, that would seem to suggest that it's possible to come to reasoned and well-grounded conclusions, even if lived experience is a large, percentage of what you're working with in a given case. Let me give some other examples here. So the excerpts here that you're looking at are pulled out of another document that's all about advancing equity through health impact assessments. And I was impressed by the equity framework that's articulated here at the beginning of the document. You can see here, if you look on the left-hand side of the screen, that there is an emphasis on, quote, building community power as an important part of advancing that objective of equity. And this is broken down on the right-hand side of the screen in a couple of ways. So again, we have the assertion that community knowledge and experience should be used as evidence. And this should involve some form of meaningful engagement with communities that are facing inequities. But then a little bit further down here, it suggests that the HIA process can be used to increase the influence communities have over decisions, in part through, if you look on the bullet point on the right-hand side here, shifting the culture within institutions and among communities so that they consider community data and knowledge as evidence. So I think we've got a couple of different things going on here. Again, on one hand, we've had the suggestion that lived experience contains information that's relevant to the assessing part. But we've also got some other principles that HIA practitioners, at least on paper, are trying to enact. Advancing this principle of equity by giving lived experience that kind of status within the way people come to conclusions about what's going on. So I think that's a significant point. And I think something similar is going on here on the next slide. I am excerpting, in this case, a document that is centered on the issue of stakeholder participation, which, if I'm understanding correctly, is integrally related to the HIA principle of democracy. So again, we've got a principled rationale here that's coming into the picture. By inviting people to contribute their lived experience to whatever our process is, we are advancing that principle of democracy, as well as giving ourselves better information to work with. So this report also makes that point too. And I just wanted to highlight a couple of things that it says here. It says that when we've got engaged and active stakeholders, we're going to increase the accuracy and the value of the HIA by providing multiple perspectives. So it's note that, when we're incorporating lived experience, it's not just a matter of like harvesting lived experience for data, like more facts than we would have otherwise. It's also a matter of the perspectives that people with lived experience can offer. And arguably, if we're trying to understand any complex issue, it's something that we're going to want to try to look at from multiple angles, including angles that we wouldn't have access to if we didn't get people on the ground involved. And then it also talks about incorporating information not readily available with other forms of evidence. So again, there's a perspective point and there's an information point, and both of those things, I think, are significant here. Now, if you look at the very bottom of this slide, you'll see that this report also makes use of this idea of ground truth. And I can't actually see what's on my own slide here because the little bar at the bottom of the screen is in the way. Let me see if I can move it. There we go. Okay. So what it says is that during assessment, stakeholders, including community advocates, neighborhood groups, can play the role of interpreting and validating staff research. So they themselves can be gathering local data, or I suppose just sharing local data that they already have, in order to help to determine whether a particular conclusion is accurate and complete. And I'll come back to that ground truthing idea in just a minute. So this is what I found in some of the HIA-related documents I've looked at. I'm sure there are other things that we could point to. Other folks on this call will have to be the ones to comment on just how well this talk matches up with the walk, generally speaking. But I did just want to touch upon at least one example of walking that's going on right now on the cumulative impact front. Oops, and I've lost the ability to advance the slide. There we go. So some of you, I'm sure, are already familiar with this example. There are some big things happening in Chicago right now around impact assessment. The Chicago Department of Public Health has just released a citywide cumulative impact assessment. And there's a lot more to it than what I'm able to show you here, but I did want to highlight a couple things that I think are relevant for our purposes. Firstly, you'll notice that during the scoping phase, they asked some questions that pertain directly to this issue of lived experience. They asked what populations are most affected by cumulative impacts, such that their experiences should be centered in this assessment. Right? So, that idea of experience shows up right from the very beginning of their process here, notably. And as you can see a little bit further down, one of the things they did at the very front end was to go back through public comment that had accumulated over the years, but not necessarily been adequately processed, much less acted upon. And they did that so that they could produce what they called an initial community input summary. And here's a little summary of the summary, where they are identifying, using some coding methods, themes that emerge from that, from all of that public comment, and so that they could be prioritized and foregrounded within the rest of the assessment process. So, I'm not going to get into too much detail with any of that here. These are just a few examples of themes that they came up with based on that assessment of the qualitative data they had collected from community members over the years. So that was during the scoping phase. You'll find that they also provided a variety of opportunities for the public to get involved in the actual assessment phase. So these are some examples of that. They set up tables at community events. They had cumulative impact assessment sessions, focus groups, online public comment, and so on. So again, they were just trying to open up a number of fronts, I think, with respect to lived experience as part of the assessment process. And another thing that shows up in this document that I thought was really interesting, back to that concept of ground truthing, is that they talk about how they're going to create a formalized structure for ground truthing via qualitative data collection. So my sense is that that's still in a preliminary stage at this point. But that's the kind of thing that I think we're looking for right now in this moment that we're in. It's not just more validations of the importance of ground truthing or lived experience or whatever. Now is the time to really get serious about how we operationalize these concepts. And it'll be interesting to see where this goes in the case of Chicago. Now, if you have any recollection of the title of this talk, which maybe you don't at this point, you may be wondering how narrative and community narrative in particular fit into the picture that I have been painting. So I think it's worth saying that lived experience is often conveyed in the form of stories. And nonfiction stories are vehicles for the communication of information and reasoning from storyteller to listener. But of course, they're not just that, especially in contexts where people are hurting and are desperate for help. These stories may be calibrated to produce a particular effect in the listener, to stimulate sympathy or outrage or something of that nature. And that means they often make use of dramatic devices of various kinds. And one reason why stories of lived experience, I think, are sometimes dismissed is that people see them as being overly performative or theatrical or hyperbolic. And I've personally witnessed cases where those aspects of storytelling lead people to miss or dismiss the truth in what's being said. I think we can't let knowledge be ignored or invalidated because of the package it presents itself in. Rather, we need to understand that, or we just need to understand some things about stories and about how stories work. And thankfully, there is a wealth of scholarship on this subject. We know that stories are incomplete, that they're perspectival, that they're thematized and dramatized and so forth. But we also know that they are invaluable and arguably inescapable scaffolds for the organization and conveyance of human knowledge. And there's a robust body of literature within the medical field that I think can serve as a source of inspiration here. So-called narrative medicine emerged in the 90s as a corrective to the technocratic and paternalistic approach that the medical field was famous for. So doctors like Rita Sharon began to argue that they could not develop a full or accurate understanding of their patient's conditions without listening carefully to the way patients related their own experiences. This kind of listening demonstrates respect and builds trust, but it's also envisioned as a boon to diagnosis, to getting to the bottom of what is really wrong. And it's premised on doctors possessing, quote unquote, narrative competency. Not unlike English professors, they need to be able to recognize the elements of narrative when they see them and analyze particular stories in a way that captures what is most important about them. As in HIA, this kind of close engagement with lived experience is also linked within medical practice to the principle of democracy, to the idea of the co-production of diagnoses and treatments, with patients and doctors working together to develop a shared understanding of the problem and a mutually agreeable strategy for addressing it. So that's thinking about the importance of narrative on an individual level as a way of recounting impact. The community part comes in when you have a critical mass of people within a given context engaged in a collective effort to reason and communicate about something being experienced at a larger scale. In cases of health and environmental harm, the community could be seen in aggregate as the patient trying to explain what's going on, what's most important, what needs attention. It's important to capture those larger narratives, in part because they often become the lenses through which individual community members make sense of their own experiences. So, for example, the idea that the residents of Flint were abandoned during the water crisis, treated as if they didn't matter, became a very prominent part of community representations of the crisis. And people who may not have been using that precise language to begin with may have adopted it as their own once it caught on. That sort of thing changes the impact landscape we're dealing with, especially when it comes to things like mental health and trust and so forth. So in closing, I just wanted to sketch out some steps that I think will be necessary if lived experience and the knowledge that stems from it are to be put on a firmer footing within impact assessment, especially as, again, it starts to creep into regulatory contexts. First of all, I think it would help to have a little bit more conceptual clarity and consistency when it comes to the terms that we're working with. Not just lived experience, but other related terms like experiential or personal knowledge, local or community knowledge, traditional ecological knowledge, community narrative, and so on. These kinds of terms are thrown around a lot these days, but not always with a lot of precision. And especially to the unconverted, lived experience can sound like a redundant, fuzzy, kind of feel-good concept, I think. So it's important to show that, no, it's a serious concept that is being used carefully and not in a knee-jerk, unthinking way. And it's a concept that not only has practical significance, but deep philosophical roots. It has epistemological foundations and epistemological value. One of the things that has been working against lived experience, of course, is that for those who tried to divide up the world into science and non-science, which includes a lot of people at agencies who think their job is to make science-based decisions, lived experience falls squarely on the non-science side of the dichotomy. Now, I wouldn't want to claim that there's no distinction to be made between conclusions that are more or less scientific in nature, but I think it's important to acknowledge that the dividing lines between science and quote unquote non-science are not as stark as we often make them out to be. Scientists make use of experience and narrative, probably more than they'd like to admit. And on the other side, a lot of what communities do in processing their experience and arriving at conclusions, even collecting data, has at least a proto-scientific character. Before the engineer helpers came along in Flint, Flint residents were already collecting and even mapping out data on water quality. They were making comparisons. They were thinking about what makes for quality evidence and so on. They didn't need people with degrees to tell them to do that stuff. Sometimes traditional ecological knowledge has been described as itself a kind of science, although one that differs in some important ways from Western assumptions about what science is or should be. Furthermore, when we're dealing with the kinds of wicked problems we're usually dealing with in the health and environmental spaces, it may be that traditional assumptions about scientific practice aren't appropriate. We might be dealing with issues that call for post-normal science that embraces more heterogeneous methods of arriving at conclusions. That may lead us to the idea of the co-production of knowledge. And the co-production of knowledge doesn't have to look like citizen science. We don't have to get everybody acting like little scientists in order for them to make contributions to our understanding. Thirdly, even if everyone was of the opinion that lived experience was important, there would still be all kinds of practical challenges associated with accessing it, processing it, incorporating it into decision-making, and defending our use of it when challenged. And of course, we're not just trying to understand when we do assessment, we're trying to uphold and advance principles like equity and democracy. So we need to figure out how to make use of lived experience in a way that isn't extractive, that actually empowers people to be part of the solution to their own problems. There's also the matter of integrating different kinds of data. Should that be our goal in the first place? Does everything have to be integrated? How do we weigh different kinds of evidence? There's a lot to be unpacked there. And here I would highlight work that my and Sandra's colleague, Christy Ellickson, is leading on incorporating mixed methods approaches into impact assessment. When it comes to fostering narrative competency, there's a lot that's involved in that. And beyond just understanding stories in general, we need a way of determining when it is we're dealing with a community narrative that is more than the sum of its parts. On that front, I'd like to highlight the work of Jennifer Carrera, Kent Key, and their collaborators in Flint. They've created, what they call the Flint Water Community Narrative Group, which has used a variety of qualitative methods to build out a community-driven account of the origins, significance, and impact of the Flint water crisis that captures better than other accounts the, quote, totality of the lived experiences of Flint residents. So there are ways of doing this, I think. But if we're going to get at a community narrative equitably and democratically, it will be necessary to build the kinds of long-term relationships of respect, trust, and collaboration that Dr. Carrera and Key's work is rooted in. Finally, I think there are some other hard questions that need to be tackled here. Lived experience has its limitations as a basis for reliable conclusions about the world. We can be wrong, sometimes very wrong, about what we think we know. Social psychologists have given us ample evidence of the flaws in our perception, memory, interpretation, and judgment. Similarly, sometimes the stories we tell can obscure more than they reveal. They can become dogmatic and inflexible. They can even entrench and exacerbate certain kinds of harm. Sometimes an impact assessor may find themselves in the uncomfortable position of feeling like they need to contradict claims that they'd rather not have to contradict, or trying to correct or reorient narratives that are compromising our understanding or holding us back from implementing solutions. This is a really delicate matter, especially when we know that solutions to the kinds of health and environmental issues we're talking about are going to depend upon community buy-in and active involvement. So what do we do when our priorities come into conflict, when our efforts to develop a full and accurate understanding of impact butt up against our commitments to equity and democracy? It's easy to come up with examples of what not to do in those instances. Regrettably, we've seen a lot of those in Flint. It's much harder to flesh out the right way of proceeding in these cases. But I think it's important that we give it some careful collective thought. So that's all I've prepared for the sake of teeing up today's conversation. And I'm really looking forward to hearing what everybody else has to say about all of this. So again, thanks very much for having me.
Thank you so much, Ben. That was great. We are happy to take questions in the chat, or if people just want to unmute and ask questions, get the discussion going, that'd be fantastic.
Maybe I can, in the meantime, figure out how to stop sharing my screen. And there we go. It looks like Susan has a question.
Hi, good
Right.
afternoon. It's not so much a question, more so just a quick comment. So I'm a part of the CDPH team, the Chicago Department of Public Health team,
Oh, great.
who was involved in the community impact assessment. So I just kind of wanted to thank you for, highlighting our work. I really appreciate it, and really appreciated, some of the takeaways too that you shared around like narrative and its importance in this work. So just wanted to just thank you for that. So.
I appreciate the appreciation, and if there's anything I got wrong or that should be supplemented in some way, please don't hesitate to chime in with more details or corrections.
No, of course. And I'll share my contact information. Happy to connect with you and anyone else. Thanks again, and thanks to Sophia for convening all of us. I love your work with your webinars. Thanks.
Great, thank you.
Right. Anyone else have questions, praise? We'll take it all.
I'll take all the praise I can get. No, yeah, I mean, any comments, musings, certainly it doesn't have to be just questions or praise.
Yeah. If anyone has any experience that fits into these stories, that'd be
Or
great
criticism,
too.
also criticism, correction. Very open to that as well.
This has not really been relevant to my job, but it's something that like I often, I guess, like come back to when it comes to community experience. Basically, my worry sometimes is that I don't know if one considers I don't know, like some rural communities worrying about like LGBT people, or like, certain things that might actually cause harm to people within those communities that are still common belief systems. Honestly, the bigger worry, I guess, would be something like the real crazy stuff like QAnon and stuff like that. And like, I wonder, should such my thought personally right now is such things are often representative of something going on, but they should be taken with a grain of salt, as opposed to necessarily completely discarding them or like, fully trusting them. What is kind of your perspective on things like that?
Yeah, so one of the reasons why I don't want lived experience just to become kind of this knee-jerk phrase that's used whenever we want to sound woke or something, is because I think it's really important that when we're dealing with lived experience, we don't suspend our critical faculties, right? And that's in a couple of respects. One is that we don't suspend them when it comes to the truth value in what's being said. Again, sometimes people can be wrong, and we do need to be on the lookout for that. But then secondly, there may be values embedded in what's said and how it's said that are in one way or another problematic from our perspective. And so I think, we want to go into any scenario where we're engaging with people's experience with a lot of respect, and again, striving to some extent to give them the benefit of the doubt, to the extent we think that that's merited, but then also with our critical faculties active and engaged. And anytime any kind of information is presented to you, any kind of claim is made to you, you would hope that that part of your brain is operating actively, and that includes, you know, claims of a scientific nature. And I think that's one of the ways to, I think, deal with some of the sensitivities here, is that, you know, we want to show that we are applying that attitude not just to community members but to everybody. When the white guy scientist comes to us in the lab coat and says this is the way it is, you know, we want to be approaching that information with the same you know, critical faculties you know, operating. So I think that comes back to that point about kind of breaking down that barrier between the folks who do things the scientific way and the folks who don't, right? You know, but I will say that when it comes to matters of environment and health, sometimes it really is possible to get people focused on the issue at hand in a way that maybe makes some of that other stuff not so relevant. So I'm speaking from personal experience here in Flint, you know, especially in the early days of the response to the water crisis. I frequently found myself sitting at tables in community meetings in between, you know, a white person and a Black person, a Trump person and a Hillary person, between people who, you know, wouldn't have otherwise been in the same room talking about the same thing, working towards the same goal. But because the water in some sense touched and affected everybody, it was possible to get conversations going across those kinds of dividing lines. And so, you know, sometimes things were said in those contexts that didn't make me personally feel very, very comfortable. But there were ways of working through them by steering people back to what they had in common, their shared objectives. And I will say that the activists that I worked with at that time and interviewed and so forth, they were very conscious about that as a strategy, about how they framed the whole issue of the crisis so that people would be kind of pointed in the right direction. And so, you know, sometimes these things are not easy, and it does depend very much on the community that you're working in. And so, you know, I think it's important just to have some good underlying relationships with people, because when the time comes when you feel like you need to speak out against something that people are saying or doing, then you need to at least have a chance of preserving that relationship beyond whatever that incident is. And I have found myself in that position a couple of times here in Flint, where before saying something, I've really wondered, you know, what things were going to look like on the other side of that. And it's not easy preserving those kinds of relationships. You've got to get to the point with people where they know that even if you have a difference of opinion, there's still something fundamental that is linking you, uniting you, that there's still a fundamental respect there. So anyway, it's not necessarily a straightforward or easy answer, but it's a really important question. I noticed that we've had a couple of posts in the chat. Maybe I can take Salim's questions here.
Sure, yeah. Do you want me to read it out?
Sure.
How do we make this into an established process that fits with an HIA methodology? Can your approach be replicated, or is it a one-off because of local contextual factors?
Yeah, that's a really great question. First of all, thanks for both of those questions. You know, and to some extent here, I'm going to have to defer to the actual practitioners, because I think it's a lot easier to talk about this stuff in the abstract and a lot harder to actually do it. And you know, again, I don't have a lot of experience with the actual doing of it. And, you know, I think one thing to point out here is that there are different kinds of HIAs that are used in different contexts, right? So if you're talking about a kind of HIA that has a lot of importance to a community, but it isn't necessarily going to be incorporated into any kind of regulatory decision-making, then I think you can probably get away with a lot in terms of how much you depend upon lived experience, how you collect it, what all you do with it, and so forth, right? And, you know, I think that the more we get communities involved in the HIA process, the more lived experience we're going to end up with just kind of by default, and the easier it's going to be to convince people that that's an important thing that should be factored into our considerations. when you flip it around and you look at it from the regulatory standpoint, then there are different considerations that factor into the picture. And I'm still learning about that context because I myself have never been a regulator. I've never worked for a health or environmental agency or anything like that. I just know what I know through the advisory group work and stuff, and talking with EPA folks in particular. But one of the things I've gathered there is that there is a huge amount of worry about what the legal implications are going to be of doing anything at all. And so, every time anything's being proposed, somebody is imagining ending up before a judge and having to explain why they did what they did and why it should hold up in court, because they get sued every time they, turn around. So, that really complicates things because, certain things that sound like very intuitive to people who are involved in this work, might be perfectly intuitive and appropriate and so forth, but they're not necessarily going to hold up in those kinds of contexts under the current circumstances. Now, it's not that things can't change. And I think that, maybe what we're going to see moving forward is just kind of this gradual creep of validation that does result in some more institutional structural changes. But that part is probably going to be a slow process. So part of my answer to this is that it depends on what kind of an HIA you're doing and what that context is. So that's part of the context that matters. Of course, another contextual factor here is what kind of a community you're dealing with. You might have already a robust set of community organizations that can just kind of offer their services and partner up with you in order to make the HIA more robust. In some communities, there are real issues of capacity on the community organization side. So, we see a lot of that here in Flint, unfortunately, is that, a lot of the things that I call groups in Flint, because that's what they call themselves, it's really like one person or like maybe 3 people, and they're just doing all they can do to keep their work up and running. And so that can make it really, really difficult, especially with there being so many needs on the ground that people are trying to address. And so, I think that, and this is one of the things we've been saying to EPA in various contexts, is that if we're going to create conditions under which there can be meaningful community partnerships, we've really got to make some resources available to communities for capacity building purposes. We need to give them the assistance that they need to start groups that are real groups and to bring people in and to have events and all of that kind of stuff. If we don't have sustained activity of that kind, it's going to be really hard to make this kind of collaborative work happen and to make it meaningful. So, that's part of the challenge. And then again, there are, maybe my whole presentation kind of drops off right before the real interesting part from a practitioner perspective, which is how do we actually do this in practice? And I don't want to present myself as somebody who's like got the answers to the test when it comes to all of that stuff. I very much don't. But there is a lot of work that's been done over the years around how it is that we recognize local knowledge when we encounter it, how it is that we collect it respectfully, what it is we do with it. There's a big literature on traditional ecological knowledge, for example. Sometimes it depends on what search term you put in, right? Because there are lots of different search terms that are used to capture kind of the same thing. And some of them have spawned whole bodies of literature that are oriented around developing a variety of methods and ethical, research practices and so forth. So, I think that there's a lot to draw from, and I can get more specific if people want me to get more specific. But there are a variety of qualitative methods, some of which are easier to implement than others, that I think HIA practitioners already are using and certainly could use if they aren't. So that's another contextual thing that you want to take into account here is just how big and broad and long your study is. Again, there are different kinds of HIAs in a temporal sense as well, and in terms of how many resources are available. To me, the kind of gold standard for qualitative data collection is ethnographic immersion. But that's not possible for most people. I mean, it was possible for me because I was already living here in Flint. I spend most of every day in Flint. That helps. But for others, that's not always a possibility. So you've got to figure out like maybe how close to that side of the spectrum you can get, depending on how many resources you have at your disposal, depending on how much time you have, depending on how many prior relationships you have with community members. So all of that has to be factored in. So it's not necessarily necessary that every version of this looks identical from HIA to HIA, but I do think we want to have a sense of kind of what the aims are here and how we would do it if we could do it, a certain way, and we can try to get as close to that as possible. And thanks to Susan for putting that info into the chat. It's much appreciated.
William had a follow-up. The challenge is the cost of doing this long-term community knowledge gathering and then community development. Any thoughts on how we can sell this to be funded by city, state, district government, and even more so private companies?
Yeah. Well, I will say that this is based on firsthand experience in Flint, so take it for what it's worth. It's somewhat anecdotal, but one of the things that happened with the water crisis, and of course it helps when your community is put into like a big glaring national spotlight, and everybody everywhere is thinking about, oh, what can I do to help? But one of the things that happened at that time is that we had money flow in from a couple of different directions. So the nonprofit sector has been pretty significant, frankly, in giving grants to community organizations so that people can do community work full time. And I say that as the president of the board of the Environmental Transformation Movement of Flint, which I'll put our web link here in the chat. So I saw firsthand what it's like to get a grassroots organization going from scratch and to get the 501c3 status and to get to the point where at least one of the people involved could be doing the work full time and actually getting paid for it, to the point where she was able to leave her other job. And we still have just one full-time person doing the work of this group. But the reason why we're able to do even that is because there were grants that frankly just fell into our laps that came from a number of different organizations that were looking to fund work in Flint. Again, not every community gets the kind of attention that Flint has gotten, and so those opportunities are going to be fewer and far in between. But certainly, now there are all kinds of problems also, I should say, with the nonprofit sector. I probably don't need to convince folks of that, but from what I've seen personally, and this isn't just the only example, I've seen other examples, that's been a key means of building capacity and making the work possible. Of course, in our case, we also had a bunch of government money flow in from the state and from the feds, courtesy of everybody here. Thanks for the tax money. But that's been put to a variety of uses, some of them probably better than others. There are a lot of questions on the ground about where all did that money go and why aren't we seeing things change more than they are. But there is a lot of federal money in particular available now that was not available a couple short years ago, and that's one of the reasons why the EPA has really kind of stepped up its advisory group activity. Being a member of NEJAC has become very time consuming over the past couple of years, because for the first time basically in its history, the Office of Environmental Justice is like flush with cash that they don't know what to do with. So they are looking for ideas about how to distribute that money. And so this has, again, been one of the points that we've been stressing right now, is that there's some kinds of work around environmental justice that is just not going to be very possible unless we do the capacity building on the community side. And I think they're pretty receptive to that. I mean, that's what I've seen in my interactions with the agency folks. Of course, then there are big questions about, does the money actually get to where it's supposed to get, and does it matter once it's there? And one of the ways they're trying to bridge that gap is that, you know, they've got these thriving community technical assistance centers that they've rolled out recently. These are supposed to be networks of a variety of different kinds of institutions, including community groups that are receiving an infusion of cash right now that they're supposed to be putting to good use in a variety of ways. But, you know, one of them would be helping out with some of this capacity building type stuff. I was able to get some financial help from EPA Region 5 right here in Flint. I'm the acting chair of the Water System Advisory Council here. So we dialogue with our water managers here in the city and, you know, try to lift up resident concerns and perspectives and so forth. And, you know, we were having some pretty challenging capacity issues of our own. And I just asked Region 5 if actually they might have offered before. I think they at some point initiated this. I had complained about the lack of capacity, and you know, they were able to find some money floating around in their conflict resolution pot that they are now making available to us for facilitation. So sometimes, you know, all you got to do is ask, and, you know, they'll find some money somewhere. But, you know, you've got to know who to talk to, who to ask, how to ask. And so, again, that's a limitation that a lot of communities face.
It's interesting to hear, even with all the attention and publicity about Flint, it's still so convoluted to figure out how to get those voices heard and funding. And so that's, I don't know if it's depressing or inspiring to think about. In smaller projects that aren't getting national attention, it's going to be a lot of work and effort.
Well, and you know, the thing is, when you look on paper at all of the money that has come Flint's way, you would say, wow, if only my community, you know, received such a windfall. And, you know, one of the things that's become very clear to those of us who are doing community work is just how important that intermediate stuff is in getting money to where it needs to go. You know, we also got a bunch of ARPA money that came our way recently. And, you know, we're still debating how to use that money. And there is a lot of community concern right now that it's not being used in a way that is reflective of the community's priorities and interests. So yeah, just because there's a lot of money on paper doesn't necessarily mean that you're making that amount of positive impact within a community by any means.
Any other questions or stories, comments? It's just been so fascinating. Anything else? I don't see any hands. Well, we want to thank you so much, Ben, for your time this morning, this afternoon, and sharing all this information with us. We are recording this, so it'll be available on the SOPHIA YouTube site, and we look forward to sending that out into the world so folks who couldn't make it can see it. The next big SOPHIA event is a virtual practitioner workshop in December, and then we're doing our first in-person workshop since the COVID pandemic in April in Washington, D.C. So we're gearing up for that. If anyone wants to participate in planning that, we're always taking volunteers for that. But keep an eye on your email and our website for more information on that. And I'm going to post the link to join if you want to become a member. Our members help support all this work that we do. Oh, there was one last question. Do you collaborate with Northern Michigan Community Health Innovation Regions?
No, I don't. Maybe I should. You know, I still feel like very much a newcomer to this public health space. That's not my wheelhouse, along with a lot of other, you know, subjects. Public health became pretty central to the kind of work that I wanted to do in Flint, but that wasn't intentional on my part. It just was an outgrowth of the, you know, situation we were all in. So I'm still learning the landscape, and I'm very happy to be informed of this group. So I'll look them up.
Yeah, community health workers, advocation for community health workers helping with the advocacy process. And lots of thanks and praise in the chat. It's very great to see.
Thanks very much
Wonderful.
to everybody for listening and for your questions. And let me put my email address in the chat in case anybody
Great.
would ever like to follow up that way.
We can include that too with the email about the recording going out. Great. All right. Thanks everyone for being here. Thank you, Ben.
Thanks and take care.